So a very warm welcome and thank you everyone for joining us today. My name is Jain Ashworth. I'm the Director of Population Health at the NHS Cheshire and Merseyside Integrated Care Board. Delighted you've been able to join us. We've just a few housekeeping elements to go through before we get to a lot more exciting people than me speaking about the great work going on around Altogether Active in Cheshire and Merseyside. The meeting's going to be recorded. Already commenced, so hopefully you'll be able to share that afterwards, and all the presentations and slides will be available on the Champs Collaborative website as well, so that's pretty easy enough to follow back. A couple of chat messages already I think you've seen. You'll find that your cameras and your microphones have been muted as we go through this, but please put any questions you have as they emerge in the chat, and feel free to put your details in there as well, so we know who you are. That will be brilliant. And then finally, there was just on the social media side as well. We've been wanting to share this work with many partnerships, as you'll hear. And so if you want to use the hashtag Altogether Active handle, that would be superb. So just a quick sort of opening slide from me, if you can move that on next. Why are we here? So it's been 2 years since we launched the Altogether Active strategy. It's flown by, but this really came about it's really trying to embed physical activity, increasing physical activity in with our NHS partners and working with all our local public health teams and our two major active partnerships in Cheshire and in Merseyside as well. We wanted to try and embed that across the patch and make sure we can get the benefits that physical activity really offer to all our residents, and particularly in prevention areas as well. There's still loads of work to do and more to share about that, and that's what today's about, really, is giving a bit of a share of that work and where we want to go next on it. And so no better way to do that than with a couple of stories too. So after we do this initial video, you'll be hearing from Raj, our chair of the ICB, and a call to action there. We'll also hear from Marsh, one of our place directors, and the work particularly done in Warrington, but also what we need to do in moving forward and embedding that. And then we'd be delighted to be joined by Justine and Mike, our chief executives from the active partnerships on our patch too. So lots to share and do. But I think if that's okay, could we share the short video first, which just shows some of the great things happening.
Tucked away in a very ordinary looking container in Everton Valley is a fantastic new facility for the City of Liverpool and the whole region. Dan, this is an amazing facility, but before we even talk about the bikes, I've noticed there's solar panels on the roof.
The LCR were offering these funds for bike storage.
Yeah.
I looked at the parameters of it and I thought, well, actually we don't need to be an all singing, all dancing container. We don't need it to do much. So we're going to use the extra funds to put the solar in. And now it's modular, now it can go anywhere.
How long have you been open?
We started taking registrations in February.
Okay.
Thought already got 80 members. Yeah, demand's there.
Yeah.
I say, if you give your kids love and bikes, they go, you know what I mean? They do shoot up.
I use the bike library mainly because it's on my doorstep. It's such a great service, to be honest. I've not really heard about it before, and then I just came across it on Instagram, so I thought I'll look into it. The cost of bikes, storing your bikes, everything that goes with having kids. They're just so expensive, and I just thought, I'll give it a go, see how we get on, and it's been amazing from start to finish.
We bought Eden a bike about 18 months ago, and she's already outgrown it, which meant that we'd have to fork out another £100 for a bike, which obviously in today's climate is not something that is readily available. So it's just great that this place is available. Get the bike that you need, make sure you just look after it and return it when you need to.
You come to the bike library, you get a free helmet, I got gloves, just everything that you could want to go with your bike.
Talk me through, what's the process, how do you join?
All online at first.
Yeah.
Once the registration's sorted, they book an appointment. Once they book an appointment, you obviously come down in, you get a fit, everything else. Helmets, gloves, bikes, whatever you need.
Well, I think it's about time I join, isn't it?
Definitely, yeah.
So I'm now proud to be a member of the L5 Bike Library. Get online, search it, find the QR code and join in. It is accessible to anyone and it's brilliant.
really grateful. Just that's one example of some fantastic work going on in our places and partners, and trying to get our inactive residents active more and reducing the barriers to access too. So if I can then move us on to introduce Raj. Raj is our chair for NHS Cheshire and Merseyside, and I'll let him take it from here if that's okay.
Thanks, Ian, and a great video and a great example of what things that we can do when we get together. You can see some words on the slide there, and I'll talk to some of them. But I'm just going to make some points of emphasis, if that's okay. Firstly, is about the role of leadership. This is called a stakeholders event. It's called that really important because we as leaders, wherever we are in our system, have a responsibility, a stake in ensuring that our populations are the best that they can be. And we can't understate, or what we need to be careful not to overstate, the impact of leadership. And we know in a system such as ours, which is complex, it sometimes can feel very impersonal to the people that we're serving. You know, when we get the right sort of leadership, who are motivated in by the set of values that are really important to us all and the communities that we're serving, we can move mountains. So I was hugely impressed and really pleased to see and learn about the Altogether Active programme. And really importantly, from our perspective, from the ICB's perspective and the HCP's perspective, to have such great alignment and synergy and co-production with the Altogether Fairer strategy. Hugely important, because we know as leaders there's lots of things that go on, there are lots of strategies and programs, but the simplicity of the messages that are in Altogether Fairer and programs like Altogether Active is really important. The last couple of things on this slide I just wanted to mention was the importance of measurement. This is not about a hope and a prayer and things will improve. We know the programme has got some specific measures through our Marmot beacon indicators that will give us a really good signal or indication of whether we're making progress. And lastly on this slide, I just wanted to mention the political and social context. We know it's changing. We've got a new government in place, and many of us are very optimistic about some of the noises, some of the messages that are coming out of the new government. We'll wait for the King's speech and we'll hear what initial legislation and programme of events that the new government is planning. But we also know there's going to be some risks, risks of change, you know, getting disrupted from programmes that we know are working. So we as leaders need to keep our eye on the ball and make sure that we continue to make really good progress on the things that we know are important to our communities. If I could move to the next slide, please. So I was flabbergasted when I saw this slide. And I kept on looking at it and looking at it and looking at it. And you can see the quote there from Chris Whitty, Chief Medical Officer. But just look at some of the numbers on that slide. At a time when we know health and social care are in crisis, where we feel starved of investment that are needed to make a difference, just look at the opportunities that could be delivered to us through, I was going to call it simple, but it's not simple, through additional physical activity. Some of those numbers are remarkable. And even if only we achieved, I don't know, a quarter of those numbers, i.e. each percentage, we would not have a financial issue in health and social care. Because if we flip to the next slide, where Sports England have done some estimates about the value of some of this work, it's enormous. £85 billion worth of social and economic value for community from that community physical activity. Just the small case, 900,000 cases of diabetes, staving off the onset of type 2 diabetes, generating £3.6 billion worth of savings. The savings that are associated with this and the health benefit and well-being benefit associated with physical activity completely dwarf anything else that we can do as systems in health and social care to make things better from a value for money and a impact basis. So it feels like a no-brainer. So why aren't we doing more of it in our health and care systems? Is the question. So we can go, if we could go to the next slide. And this is hinting at some of the reasons why we need to make some brave decisions as leaders at all levels in our system, but also reflecting on the approaches that we've had in the past and making sure that we are fit for purpose and doing what the evidence is telling us. And there's three things I wanted to talk about. One is the whole system. I think most of us know what that means, but it does mean, things like the local authority, the NHS, charitable faith sector, our workplaces and companies working together for common aim. And it's easy to say those words. It's hard to achieve in practice. And we in Cheshire and Merseyside, through the Healthcare Partnership, have made some significant progress on getting alignment across the system to work on a set of common few priorities, with physical activity being one of those. We know that having a top-down approach is not always the best way of doing things. So working in a linear way in our system to try and get improvements is not the best way to do it. We need to empower our local communities who really understand the context, the hurdles, and the solutions to improving people's chances of more physical activity. Everything from tackling safer streets to tackling the way that transport works, to access to green spaces, to understanding, the much better than we currently understand as a system, the impacts of poverty on people's ability to do physical activity, and what things do we need to do to support that. And we've just seen a video that talks about that. So working in that non-linear way, what that really means is empowering our communities, and our role is to support those communities, to solve those issues, and to enable them to get the physical activity we need to support them on. And finally, being relentless. And this sort of relates to the comment I made about the new government coming in. There is always a want to bring in a new policy, a new strategy. Politicians like to do that, don't they, nationally? But locally, we know that consistency of purpose is what makes a difference to our communities. So this is a long-term thing. And hearing the same messages day in, day out, year in, year out from our leaders is really, really important to ensuring that we set priorities, set funding allocations, and set time and attention to the things that really matter. So being relentless or unrelenting in our approach to supporting our communities to be more physically active is really important to us. So I think that's my last slide. I'll pass back to Ian.
That's great, and thank you very much, Raj. It's incredibly important having your leadership within this space with the ICB, but also I know we're joined by colleagues from the Healthcare Partnership and some of our political leads in that space as well, which Mike will come on to shortly around that. But really help. Thank you very much for that. Like we said, we had quite a bit to get through and share, and I'm delighted that just showing that joined up approach with we've got a massive place that we cover in Cheshire and Merseyside, but the fact that we're here together with a joined up approach all together active, and have Mike from Active Cheshire and Justine from MSP, our active partnerships here, it's brilliant. So a warm welcome to you both. I'm going to pass over now to Mike and Justine, if that's okay.
Thanks everybody. Good afternoon. Thanks, Ian. And can I echo your thanks to Raj as well for your slides and your comments, Raj. I've had the great pleasure of chairing or co-chairing Altogether Active and the Altogether Active board for 3 years, and it's been it's been a huge challenge, but it's been a great opportunity to do exactly what you said, Ian, which is bring people together. And if we can just flick on to the next slide, please. The reason that we've brought people together is to try and reach some of these strategic aims. And as I just give you a moment just to read through some of those, I was with a place director in Oxfordshire a couple of weeks ago, and they're taking a similar approach to ours in Oxfordshire. And the PD there said one of the best outcomes that they'd received through an approach similar to ours was actually enabling a much simpler communications and commissioning plan into the physical activity sector. And what we've done across Altogether Active is bring together between 90 and 100 organisations who've got shared purposes around physical activity and are really striving to make change. So it would be really easy of us to jump straight to strategic objective number 4 there and ensure, which we will, that 150,000 people become more active. But actually, we're trying to create more than that. We're trying to create simplicity in a complex system. And that's really what we're hoping to do, in that talking to Altogether Active, you're talking to the physical activity community who can provide many forms and many functions. And Raj mentioned earlier the importance of evaluation and monitoring, and through our Altogether Active evaluation group led by Liverpool John Moores University, we're really seeing how the system's working, how the system's maturing, and how we can ensure that physical activity is demonstrating reductions in health inequalities. And in addition to some of the return on investments that Raj mentioned earlier, we know that physical activity can deliver reductions in other areas and other calculable areas, like reductions in GP appointments needed for some of our members of our communities as well. And we hope to be able to bring that evidence to everybody and share that with you as quickly as possible. If we can pop on to the next slide, please. Thank you. Really just a description of our progress over the 24 months since launching our strategy. And as always with these great diagrams, they're really the tip of the iceberg. There's been some fabulous work happen behind the scenes to make each of these milestones possible. What we've noticed along the way is that sometimes our messages aren't communicated well enough, and we're working really hard to address that. And that's really one of the drivers behind today's opportunities, ensuring that when good things happen, or when good opportunities arise, or when we learn from bad practice, or when we learn from good practice, that we share that information really, really carefully. And we're really looking forward to delivering another 24 months of growth and opportunity within physical activity, as well as those 100 partners come together behind our mission of a more active Cheshire and Merseyside. So if we just pop on to the next slide, please. In terms of progress, we've got a really a kind of useful map around the progress that implementation from our strategy is making. And it's really, really important for us as an Altogether Active collaborative that we understand the primacy of place. This isn't about Altogether Active doing to place. This is about Altogether Active doing with place and with those communities in which we serve. Different parts of different places, across Cheshire and Merseyside are at different stages of having a specific and measurable physical activity implementation plan in place. If you're not sure what yours looks like or what yours feels like, please feel free to get in touch and we can happily share that in much greater detail with you. But these are plans that have been driven by place, that have been developed at place. What we hope to do is not just count numbers 9 times. We actually want to share great practice across these different places and share the opportunities that have been grasped by place and ensure that they are scalable and measurable right across our system. So just jumping on to our final slide, or my final slide, if I can ask for it to be moved forward. sorry, my penultimate slide. We've tried some of this, and we've had some excellent successes. We're piloting. We're looking at proof of concept really around scalability. And as you can see by the list of some of the opportunities that have been grasped, physical activity isn't about putting your boots on at 3 o'clock on a Saturday afternoon and playing 11-a-side hockey or 11-a-side football, or putting the netball bib on and playing for 60 minutes. It's really looking at grasping the opportunities that physical activity can have in both a prevention and a treatment environment. And there's been some fabulous work happening, and each of the proof of concept and the pilot work that you can see detailed here. We can share all of the evidence and the opportunity that sits behind these, but we're really excited about finding new opportunities for physical activity. And if I can build on Raj's call to action, that's really to say, we could ask that, can you grasp that as well? Can we help you grasp that nettle and make a difference and see what difference physical activity can make in your own area of work? So if we move on to what I think is my final slide, Altogether Active's been built and the strategy was written in such a way that we hope that it talks to all of the people and all of those roles which are listed on the screen. This isn't something just for commissioners. This isn't something just for GPs or just for sports coaches. The resources that we've built, the evidence that we've proven, and that we can share, really speaks to everybody right across the system. So hopefully you can see yourself somewhere on there, and if you can, then we hope that you'll join us on that journey of eradicating sedentary behaviour, because we believe that that's a real key opportunity that physical activity can help us grasp. So without further ado, I will hand you over to Justine, my counterpart at MSP, to take us forward from there. Thanks, Justine.
Thanks, Mike, and I echo your thanks to Ian and Raj in terms of being here today. And I am relatively new to this, so co-chairing this strategy piece and really starting to wrap my head around it. So it's fantastic, and it's a great opportunity from an active partnership perspective to be part of this. So really exciting. I'm just going to cover a couple of slides here in terms of I guess our role a bit as an active partnership more broadly, and it kind of picks up on the points that Raj made about a whole system approach and how we need to design moving into day life for everyone. And this picture looks a bit gloomy and a bit bleak in some respects, but it is deliberate in the sense that this is some of the barriers that we put up within the physical activity sector itself. We've got a green space, but we've put a nice, a really unfriendly railing to keep people out of it. And I think if you kind of zoomed into that door, you'd find that there's a big padlock on it. Well, so you can't even get in the clubhouse or the toilets or all of those things that are really important to people when they want to engage in being physically active. One of the things about a whole system approach is that point that I think Raj made before, but starting with people in their place, understanding where they are and really starting to get in alongside them to understand the barriers that they have, and then really get a deeper understanding of what might work for them is now part of our role as active partnerships. An opportunity to test and learn. For many, many years through a sport and physical activity sector, I guess we focused on projects and programs that were short-term funded, and we flogged them sometimes when we knew that they weren't necessarily working. And they certainly weren't reaching the right people in terms of this context, in terms of people who are inactive and people who face the greatest barriers and the greatest in terms of inequality. So it's a really important point here about the opportunity now to be much bolder and braver and more courageous in terms of that test and learn. And when things aren't working, shift really quickly to something else and engage with people as you do that. we have an unrelenting focus as Active Partnerships on behalf of Sport England, I suppose, through Uniting the Movement strategy, to focus on the inactive and underrepresented groups. So tackling inequality is the golden thread through all of our work and in terms of all our investments. So any investment that we get is very much focused in that way. That point again about whole system approach, all partners in the place, it's been picked up a few times. Mike alluded to it there in terms of all the people in that grid, probably goes way beyond that as well in terms of people across the system. And that whole bit about learning and the fact that we've got John Moores University on board with us in this work around the Altogether Active strategy is really key. That it's about a live learning loop. It's about that opportunity to learn as we go and to keep feeding that in as we go so that we can make those shifts and be really agile in this as we move forward. Could I have the next slide, please? So this is a bit more detail, I guess, around that whole idea of a whole system approach and how we go about designing moving into everyday life for all. And something here that I use just to help myself, I suppose, a bit is having worked in the public sector for 30 years, there is something for me that at one time we were very much about being top down, thinking about the fact that we could fix people, we could work, behind closed doors in quite a lot of our cozy environments in offices and come out with something that we then thought would work for people in their place. And actually, in some respects, when you think about that, it's a bit like madness, isn't it? And so with this diagram, my sort of take on it is very much, how do you flip it round? How do we flip the lens round and actually get in alongside that individual or the community and look up and out at what they see? What do they see when they're in their street, their home, their community? What are the things that are there that matter to them? And therefore are key to them in their lives, which usually takes us to a conversation about their health and their well-being. And then how do we look across all these layers of the system and help to line things up to make it easier, remove the barriers in each of those layers that then definitely bring together that whole system approach. And in addition to the kind of usual socio-ecological model for a whole system approach, there is an additional layer here around cultural norms and ideologies. And I think that's a really useful addition. I'm going to stop there. I can see Tracy's put a hand up. So I am going to pass over.
Brilliant. Thank you so much. And a very warm welcome, Justine, for and joining us in this second. Lots to get to, but actually, it's just been a brilliant start by both our active partnerships in this space, and I really appreciate the work that you and your teams have been doing with our partners in there. Really, it did just jump out to me. I mean, before we bring in Carl, did just jump out to us, like. It's so important, isn't it? The inequalities in some places that exist. So I'm blessed in my neck of the woods that I spent the weekends at netball presentations, and I've even been blagged to take on a management role in a girls' football team and what have you that goes with all of that. I might live to regret that, but it does reinforce to me just the importance of volunteers, having things locally, the support that can be done to create physical activity opportunities. And not everyone has the same opportunities as that, which we want to try and get beyond. And what can we all do in that space? So brilliant. Thank you for flagging that and colleagues with that. Right. We then move on, I think, to hear from one of our place directors, Carl Marsh. And Carl was really grateful for you joining us today, Carl. Yourself and colleagues helped really launch the strategy a couple of years ago. And we just wanted to have a bit of a informal catch up about how that's going. And we've got 2 questions to put you on the spot, if that's okay, Carl. And they for everyone else to see, if you want to just put it onto the next slide for us. One is direct and to the point. What have you done in your local place about making physical activity a priority? And we're looking ahead. We've got a session in October, a face-to-face stakeholder session. And what's been your 100-day challenge about embedding physical activity in your place plan? So I'll leave those two to ponder on, if that's okay, and share your wisdom and thoughts.
Ian, thank you very much. And I'll try and build on what's gone ahead. So I'm Carl Marsh. I'm the place director for the ICB in Warrington. I'm sort of here today to represent all of the 9 place directors, trying to do that in 10 minutes to get into the breadth of some of the things we are doing and some of the challenges and how we're addressing those, and our strategy helps with that will be a bit of a challenge. So what I'm going to do with those 2 questions is I'm going to look at those through the perfectly jaundiced lens of what I see when I look through the window, in terms of, and Justine was talking about this, it's about what we see. So I'm going to tease some of those things out, and it's probably worth starting with that personal odyssey. So when I launched, it feels like a lot longer than a couple of years ago, Ian. When we launched it last time, Paul Warburton and I, one of our councillors who's on the call today, and I made the mistake of looking at the who was on the call today, and I can see quite a few from Warrington, quite a few people leading some of the things I'll be talking about. So I've got a huge dose of performance anxiety. So I'm hoping they'll be kind and supportive in the chat. But when we came last time, that there's a lot about kind of the personal things of why we get into this. And it's fair to say quite a lot of the things I do, I get in an old military jargon, I get volunteered. This is one of the things that I volunteered for. And that's about recognizing the importance of staying fit and healthy. So as a child and young person, I was pretty average, then joined the army at 16, where being fit and healthy was a necessity, a requirement, especially when your first posting is straight into a parachute brigade. And so I've always been really interested in how do we stay fit and healthy, and how sometimes challenging it is to motivate. So even as a dad and a family member and a leader of a team and a partner in place, that is sometimes quite hard to activate and motivate people into staying fit and active. And so, and part of that personal odyssey, in terms of my bona fides, one of the things I did when I worked in NHS England, we were allowed to volunteer, and I'd been away a lot, so I was allowed 5 days of volunteer, and I came and worked with Active Cheshire. One of the things I was working on at the time was a national programme about using variation data to improve outcomes for people. So I worked with Active Cheshire for 5 days to look at how they could use the data to make that compelling narrative to organisations like ourselves, but also to individuals, about the difference that staying active can make. So what I'm going to do is I'm going to talk about our strategy, and then I'm going to talk about some of the things that as an organisation in Warrington, as a partner, we are directly involved in. So we've set out our strategy. I think we've launched it. I think we might need to move to a square. We've launched it. It's available online. I've definitely signed the charter as a representative for the ICB in place. It's out there. You can read it. I think we are living some of that already. And I think one of the key things about our strategy is how it aligns to really important things, such as the Warrington playing pitch strategy and the Warrington local plan. And when I talk about some of the things we are doing, I will try and tease out why those things are really important. And the strategy focuses on 9 key themes, and key amongst them are active leadership. And Raj has talked about the importance of that, that being the change that you want to see. And I see Raj and his trainers quite often doing the active soul, and I've seen quite a few other leaders following that inspiration. So that's good to see, and it's those things that help to keep these things at the front of our mind. But also, talks about active environments and facilities, and just in your slide of the padlock and the gates, I think talks to some of the challenges that we have, and also the strategy talks about actively promoting sport and the role that all partners have in doing that. Also explicit in there is that desire to support a network of physical activity champions. I'm going to talk a little bit about how we are doing that as an ICB in place directly, and the benefits of physical activity and signpost local opportunities. So the slide that Mike put up that shows some of the difference that you can make through physical activity, and Raj talked to that, is really important. And as a team, we had a cardiologist come to talk to us and was showing us some evidence about the difference of just standing at your desk makes in lowering your cardiovascular risk than if you sat at your desk. So it's not, you don't have to be a Premier League footballer and have that level, or even the level of physical training we did in the army to reduce some of your risk. Some of it can be quite easy to achieve, but it means we might need to remove some of those barriers, like the padlock and the gate. And at the same time, we've developed this physical activity charter that I talked about, that key organisations across Warrington have signed. So what I want to do is give some examples and talk about some of the drivers for those. So we know in Warrington that our data tells us that women, older people, and those with disabilities, and those in lower socioeconomic groups are less active in comparison, and a little bit of evidence are getting less active over time as well. So one of the things that we do as an ICB Place team is we release a member of our team who's qualified, is an instructor, to supervise an over 60s fitness session in one of our communities. And they've done that for quite some time and will continue to do so. And this group, older members within the community, over 60, 40 to 50 members, they meet once a week. They attend the local community centre. Most live within a mile or 2 miles radius of the venue. And each week they take part in a mix of cardiovascular, mainly strength-based exercise, getting out of the house and socialising. Also, on the same day, they have access to a food bank in the centre. And one of the things that the instructor, what one of our team's been able to do, is hook up with Edge Hill University and are doing a study of the group in terms of looking at dietary protein intake, strength development, and the quality of life of this cohort. And you can see the difference in this cohort that one session a week makes, and some learning from that around the importance of protein as well. So some people have changed their diet as a result of this. And it, not only that does it evaluate well by the university, it evaluates well by those who do it. They talk about being more active. I met one gentleman, that phrase, Mum, he looked as fit as a flea, and he said it had changed his life. It had made him more active going to that. But one of the things that we know is that if that wasn't there, quite a lot of those people would probably not get any form of formal exercise, and the nearest club they could go to would be about 3 miles down the road. So we know that physical proximity is really important. We also know that physical inactivity increases with age. So for Warrington, from 13.3% of 18 to 39-year-olds to 18% of 40 to 64-year-olds are inactive. So one of the things that we are directly involved in is in one of our communities is hosting a drop-in touch rugby session. So you'll know what Warrington, the home of rugby league, 20 to 50 between the ages of 20 to 50, they meet once a week and play touch rugby. There are around 25 to 35 participants. 75% of themselves would declare themselves describe themselves as overweight. But one of the challenges we have, and you can see the difference that session makes, but one of the challenges we have is that it quite often doesn't run in the winter because the pitch gets too muddy. And we know that the nearest other site to that would be all weather is about 8 miles away, and there's not much interest in moving from a local site to another site. So we know that in our strategy, that alignment, as I mentioned before, the Warrington pitch strategy and the Warrington local plan, so we can start to address some of those challenges, is really important. And another thing that we are doing, and this is led by one of our primary care networks, and I think I saw them come onto the call, so it'll be interesting to get something in the chat if we can. That they are collaborating with our health wellbeing provider and Warrington Wolves Foundation, and what they've been doing is, I think, if I'm right, is risk stratifying patients. And those with obesity from their list, and inviting them to participate in a 12-week exercise program at the rugby stadium. And currently, I think we've got about 60 to 80 patients signed up to that. One of the findings is that people are responsive, probably more responsive, if they're invited by their GP from their practice to join something like this. And using the rugby stadium helps to engage people by harnessing the power of sport. And then one final thing from me, many will know, and the kind of drive behind this is on the call today. Councillor Paul Warburton. Warrington hosted stage 3 of the Women's Tour of Britain to help spread a positive message of the impact and benefits of being active, and you can see that gets people really interested. It gets bikes out the garages that people haven't probably ridden for a while, and it gets people moving and active. So there's some small examples that I hope demonstrate our commitment, and these are happening across all partners in Warrington and across all partners across our 9 places. But you can see those small examples when you bring them together, enabled by the Warrington and Active strategy, unblocking some of those barriers that we've talked about, where you can create that movement around move more and more often. Ian, I think that's me, so I'll hand back over to you.
Thank you, Carl. And it's superb to hear all that work, and there's some brilliant examples in the chat too about that. And I suppose that's the reason why we're here today, is we need to fly the flag for this, how we can then support our other places, and also, put a spotlight on where all the good work is going on. So Raj has a call for action for us, Raj, in this space, don't you?
Thanks, Ian. So I've got 3 things to ask of you. And we've just heard from Carl. We've heard the passion that Carl displays for this agenda item. And one of the things we're hoping is that you will be inspired to do things. Now, also, I'd ask you to feel accountable for doing something. And if I translate those into calls of action, as I say, I've got 3. Firstly, it's about you, yourself. What are you going to do? How are you going to role model for your teams, for your organisations, for the communities that you work in, that this is a really, really important topic? That's not something that just sat on the side. That's essential to our well-being of your colleagues, your friends, your family, the communities that we serve. So what do we do as individuals? I learned a lot from conversations with Mike and Justine about why that was important, but also how to do it. I think we mentioned earlier on about active souls, and just the fact of wearing training shoes to send a signal out about that enables you to be more active in a simple way, i.e. being able to walk easier by having comfortable shoes. So my first challenge, call to action, is what are you going to do about yourself? How are you making sure that you are more physically active and telling people about it? My second call for action is, will you commit to going out and influencing minimum of 2, hopefully half a dozen people who are in your circles of influence, whether that's friends or family, or whether that's your workplace. How can you convince them to be more physically active? And imagine if we multiply that out, we can support that target of 150,000 that we want to achieve, and we want to better it. And through that approach, perhaps they will then, those people you influence, can go out and influence more people. And the third one is for each of our places to, within the next 100 days, to develop a plan, an additional plan, because there is lots of work going on, an additional plan that we see implemented in this financial year, i.e. before March 25, about how we can embed physical activity more in our existing service plans, service profiles, the way that we do business at this moment in time. So those 3 calls of action: me, am I going to influence some people who are in my circles of influence? And lastly, about our 9 places having within the next 100 days a plan that takes forward physical activity. So those calls of action, which we would like to discuss with you in October in a caring, sharing way, not a performance way, when we meet face to face. Thank you.
Very much, Raj, and to all partners on the call. It's just to give a bit of assurance as well. We continue to invest in the altogether active approach through what is the Integrated Care Systems Population Health Board, linking in with the local authority directors of public health as well. So developing those local plans together is really crucial, which is hopefully what we're seeing examples of today. We've heard about the different approaches being taken in place and why we need to fly the flag for this. And there's hopefully a in-person proper gathering in October time where we can hear and see a lot more of that progress being made and what more we can do as a partnership in this. I mean, just yesterday I was on a national call with NHS around cardiovascular disease. Lots of questions about physical activity and the links in there as well. And for us to be able to say, actually, we really joined up with this and advocating for it is really important as we move forward. Please take note of the actions and what you can do in that space. And quite aptly, we've got one final video I want to share with you before we sum up. And that video is very much an issue that is impacting across all of our areas is around falls, and some brilliant work by Everybody Health and Leisure to show the work the physical activity can have benefit and prevent falls. So could you just share that quick video and then we'll go to the next steps.
Was referred here because I'd fallen on our concrete drive in where I live, and it caused a benign tumour in my brain, but it can't be operated on because it's in a dangerous place, and that really knocked my confidence. And when my GP referred me here, I can honestly say I have not had a fall since. And I do feel confident.
Yeah, I was going to say, since I've been coming back, I've not had a fall at all. So therefore my balance is so much improved. Whereas before, I mean, I was up and down like a yo-yo almost. But so it does give you the confidence. You get, if you're not feeling confident, you're a bit wary of going out on your own, having to walk on your own. But now, just do it.
Confidence and camaraderie.
And
yes,
definitely.
That's it.
That is a very big part of it.
Yes, that sums it up.
Sums it up very nicely, doesn't it? So thank you very much for colleagues and bringing that together. And hopefully it's just felt like it's a lot squeezed in, but actually that for me it works quite well in covering the main areas. I know it's amongst busy workloads, but it's really important that we've had this session today and we can now share that as well. So please, the call to action in what you can individually do, how you can promote this within your networks and taking that forward, and then our commitment in working with all our places to drive that too. So the next step is we're going to share the presentation and the recording with everyone who's attended today. You can hopefully use that to share wider and really create some attention around that. We'll meet with our local place directors and leads and moving some of that forward with our active partnership leads. There's if you'd like to find out more about the Sport England's place expansion work that the active partnerships are leading, please do get in touch. There is a email address which will go out with all the information, but info@altogetheractive.co.uk, and please save the date for the 11th of October for our Altogether Active face-to-face stakeholder session. So can I thank all our speakers today, all the contributions of people been putting in, and things that don't actually make it on screen, and the work that you're doing in your local places to fly the flag for physical activity. And have a fantastic active day for the rest of the day. Okay, thank you very much.